Dr. Christenson, tell us about insomnia. People not sleeping, and not sleeping in itself causing major problems in life, lifelessness, and all kinds of things, accidents, and all that. Give us some of the causes and give us some of the ways you handle that and improve that situation.
Well, insomnia can be either
annoying, very annoying.
People can't fall asleep, number one. Or they fall asleep and then wake up 3 hours later and they can't fall asleep. They can't stay asleep. So either way, it's like there is a deficiency in your energy, especially in the, yin and yang balance. Yang is like daytime, very forceful energy and hot and fast, and then the kind of yang energy, and the yin energy is totally opposite. It's nourishing, restful, and at night, dark, cold, or nourishment. Those are the yin energy. And if you are insomniac, you are awakening. That means that your yin energy is at night is the yin energy is deficient, so you cannot anchor down. And in that case, we can approach with acupuncture. We tonify the yin. There's a point, acupuncture points. You can tonify, enhance the yin energy. So it will anchor you down. So when at night, it's supposed to be night, supposed to be restful. You rest. And that's one approach we can use acupuncture. And also you can approach the food we're talking about. And some of that is disturbed because you are not metabolize the food properly. So at night, they are very active. So if you can reprogram your brain to metabolize certain food, nutrients, that at night, so it's correctable in that way. And we also teach patients to do some mantra and also do the acupressure, some of the technique that you can learn to anchor yourself at night. And so we have some of the teaching that we show people to do some of those technique. And especially if you can learn some of the Tai Chi, Qigong to move your Qi and gently and open the channel, and you can also sleep well at night. And there are techniques you can learn instead of just taking the sleeping pill. Sleeping pill is not always the answer, and people actually get really tired when they get up in the morning.
Well, what does a sleeping pill, what does a sleeping pill do? Yes, it apparently makes you sleeping. I've never taken one in my life, but it apparently makes you sleeping. But as you said, yes, I know many people who then, they still wake up somehow tired, and then, does it knocks you out, but yet you don't sleep? Does it have what are the side effects of such a sleeping pill, at least used over a long period?
Well, I think that those pills can cause drowsiness. Some people wake up not clear. And any chemical comes to your body is additional energy. And that additional energy can cause more blockage. That's from the Eastern medicine point of view. So people take a sleeping pill for a long time, usually just become intolerant to it, or they don't really they become like get used to it, so you need a higher dose. Unless you figure out what's wrong with it, it's just masking the problem. And that's not the way to approach for a long time. It's like if this one night you want to get the sleep, it's okay, but you really need to find out what's the cause of it. And we approach to that cause, it will be a lot easier. And if people have an acute stress, somebody died, loved one died suddenly, of course, we will give you sleeping pill, antidepressant, we help the acute issues. But then afterwards, we were going to have to do the other maintenance, balance, and tools that we can use. And I think that's the best of reaching the best of the East and West. I don't say that Western medication is not good. They have their own they have their own room for it. And especially for acute, it's marvelous. This is the best of West. And that's the best of our modern time. We have all kinds of good technique, the surgical technique, anesthetic technique. We have a beautiful cortisone stuff that can help people to breathe right away. No doubts. We use it. But we don't want to continue to use it for a long time. We need to figure out what is the cause, what's the next step.
Right. Well, I guess that's a very, I think that's the exactly the viewpoint, or is it the way it is? For instant relief, which is, I think, what it is made for, and then we just unfortunately keep dragging it out because that instant relief works so well, so we think we have no problem. It's like, if you have a really bad toothache and you have a swollen tooth and, the root is getting bad, yeah, sure, a heavy dose of medicine will make the pain go away, but the infection inside keeps growing, and eventually it will just explode. You might not have pain it exploding, but it still kind of kills you. So don't do you any good as such. So wonderful. All right. Well, so even insomnia can be cured with basically unstucking the flows, getting in a more even-based level of thinking, and stacking the flows physically with acupuncture, and as well as with your methods of Tai Chi and thinking and stuff like that. Absolutely wonderful. How long does it usually take till a person goes from like rather heavy insomnia or something to kind of like, hey, I love this, I sleep, I wake up energetic again?
It all depends on the person, how willing they want to change their behavior and the way they handle their health and their life. So again, if a person is willing to learn to modify their lifestyle and eat better food, it's easy to say than to do, and having a better relationship and finding themselves. So all that affect the channels, and it's easy to say than to do because we have to get into our own self. And frequently I will have person to write lists of all your angers, as many what makes you angry, and write it all down. And I did that exercise myself before. I said, when I was told to do that, I said, oh, easy, I can write it 1 page. And when I sit down, I have about 4 pages. I have things that I was mad at. So I keep writing, and then after you write it all up, and then just burn it, and you say a prayer to ask God, say, here I am. I'm ready to give it back to you. I don't own this anger anymore. So that is one of the ritual thing you can do to get rid of your anger, get rid of your worriness, and get to know yourself and learn loving yourself. It's easy to say than actually truly love yourself.
Well, that's why our people then have a coach like you. So how long more or less do you think it takes? A month, 2, if a person does a relatively decent job at it?
If you do it a month, people will see the result. They were excited, and they realize, I need to do this.
Right.
And if those who are too busy, we'll just say, wait until you're ready. We'll see you. The door is always open.
Beautiful. Right? Thanks a lot, Dr. Christenson.